I want to thank you, Mr. Chairman, for the visit you and I made to this center so we could see firsthand what the complaints were about. And I appreciate, Mr. Thomas, how we were received and your briefing and the tour we had. Before I get to my question, please indulge me for really an urgent situation that has arisen here in the District of Columbia, Southeast, and you alluded to this. I'd like to get some information. Your outpatient clinic, the only clinic for our veterans here in the District of Columbia for medical and preventive care, is about to close. Now, I understand that this facility is, from your point of view, underused. It's open only about 3 days a week. You see why it's underused. You know, when you have to keep track of when the facility is open in the first place, that leads to a vicious cycle. And it is therefore open on only 3 or 2 or 3 days, and then only half time. So you see how this plays on itself. Now, I just have to ask you, where are these veterans from the District of Columbia supposed to receive their care? Well, I understand that Prince George's has a facility. It's already understaffed. And there is Rockville in Maryland, where my good friend represents. But neither Prince George's nor Rockville are near any subway. Will you provide transportation for these District of Columbia veterans who don't have any place to go now if you close this facility?
Ma'am, thank you very much, and I want to emphasize that no decision has been made as to whether that facility will close or not.
Oh, I'm good to hear that.
The lease expires in September, and I do have to make a decision as to whether we renew that lease.
When will you make that decision, Mr. Thomas?
Ma'am, I would like to make it by the middle of July with input from both your staff and from the mayor's staff.
So you're coming to see us and the mayor?
Yes, ma'am. In fact, we have a call scheduled for tomorrow morning with your staff to discuss the issue.
I appreciate that. We just don't want people to be left with no place to go. And these veterans don't exactly have the kind of resources that you and I have.
Yes, ma'am, and I understand it's a very underserved community. We do have a physician that is there 2 half days a week and one full day a week, and we also have a nurse that is in the clinic 5 days a week with a technician, and we provide telehealth services from there 5 days a week back to the medical center. The clinic's actually been closed for about the last 10 days due to a pipe break that occurred in the building that it is in, and
so
we should
reopen.
reopen.
This clinic is decrepit in more ways than one.
Yes, ma'am, and so it's important that we look for a new option.
I want to get on to Mr. Missel before mine. Appreciate your coming to see us on that urgent matter. I'm interested that you issued something that I have never seen from an Inspector General. It was, I'm sure it happens from time to time, an interim report that was in 2017, in which you noted sufficient, quote, and I'm quoting here, sufficient to potentially compromise problems, to potentially compromise patient safety. I mean, those were the words. Is it common to come forward with interim reports like this? What were you trying to say before there was a full report when you issued this interim report?
I do not believe it's common to do it. I'm not sure our office has ever done it. Certainly in the 3 years I've been the Inspector General, we've never issued anything like that. We've got information about issues at the medical center. We immediately sent up a rapid response team, and within hours they reported back to me of significant problems at the facility. We then contacted VA to let them know of these problems, and I didn't get the kind of response I was hoping for in terms of trying to make sure these issues which impacted patient safety
when
were
you
going to
got
be
that
fixed.
kind, Mrs. Ozensky, when you get that kind of unusual, you've heard Mr. Missel say unusual warning, why wouldn't the VA get on it instantly to try to essentially perhaps save lives for the veterans who were using the facility?
I'm not sure, Ms. Norton, that I have the full answer to that. I do know that we did have VA central office staff immediately deployed to that area with specifics in logistics and sterile processing. But I believe that the issues that Mr. Missel is discussing went well beyond both logistics and sterile processing. And so the interim report was really helpful in identifying everything that we needed to do to support the medical center.
It was like an emergency report, Mrs.
Yes.
Zinsky. And I appreciate, Mr. Missel, that you were willing to depart from your usual processes in order to alert the VA. And I must say that I would hope in the future to receive what Mr. Missel said was not immediate corrective action. Thank you very much, Mr. Chairman.